And welcome back to 5 Minutes for Healing. Today we're going to be looking at the experience of hyper-arousal, which we can consider the first symptom cluster, post-traumatic stress. We can define hyper-arousal as some body-based hypersensitivity that one takes on as a consequence of the abuse or assault. The term, jacked up comes to mind because it really captures what we're getting at here, which is the bodily response of trauma. This first part of the trauma response, being hyperarousal, we know it can last indefinitely in people's lives. Some of the characteristics of hyperarousal can include a permanent state of alertness, hypervigilance, always kind of examining one's surroundings and being on alert, being irritable, being tense, explosive, highly reactive, anxious, can bleed into sleep states, so patterns of insomnia, can bleed into our relationships with others, with this chronic state of mistrust. We can experience it internally as difficulty with concentration. This hyper-awareness may be triggered by any of the senses, sights, sounds, other stimuli, sensations in the body, what have you. You could also call it like a startle reaction. And I think this is not a bad way to capture it. Startle reaction can be quite mild. Just a fleeting sense of anxiety, or it could be a full-fledged reactivity, what we could call fight or flight, panic reaction that may send some people to the emergency room. Basically, though, even though the threat has long been past, our body responds like if it was happening now. It may sap your energy. You feel like your body's being hijacked. And we need to underline the fact that this is not a conscious reactivity. No one makes a choice to be hyper-aroused. These symptoms just show up and they're embedded in our body. And there you go. And we could say, well, how do you engage with that? How can you alleviate this pattern of hyperarousal? So we have to go back to the core truth, which is hyperarousal is a body-based experience. If we have a body-based understanding, then we need to talk about a body-based way of engagement. So here we're talking about an experience beyond the talk therapy. Talk therapy will not necessarily be helpful in reducing all of what we know as being hyperarousal. You just can't get an aha and expect those symptoms to disappear. So think about body-based engagements. Think of exercise, probably the best alleviation for patterns of anxiety and depression. Meditation. Meditation has been shown as the best complement to trauma talk therapy. Yoga, mindfulness, a healthy diet, healthy sleep pattern, medication. These are all ways that we can engage on a body level. And by doing so, can intervene and alleviate some of the distress, certainly, of hyperarousal. Even the close proximity, people we trust, pets in our lives, proximity to green space, all have been helpful in addressing the anxiety component of hyperarousal. So your task here is really to experiment and develop a practice that you can work over time to develop a habitual response within your body. In this way, your therapist needs to act as a bit of a coach to get you to this practice level. And that may be a point of discussion. And there are even some newer type therapies that work more on this body level, this nonverbal level of trauma response. So practices like EMDR, brain spotting, somatic experiencing, all may be as help as well. In our next video in our series, we'll be looking at other clusters of trauma response: intrusion, re-experiencing, constriction, which is a pattern of numbing or avoidance, and then the actual wobble, the bouncing back and forth between those two extreme states. We'll be looking at those next. Thank you very much for joining us today, and we look forward to having you further in our series of 5 Minutes for Healing. Until we meet again, friends.